I'm joined by Sarah Wrightson, occupational therapist. Sarah's the manager of rehabilitation services for Morris Hospital. And we're going to talk about the who, what, and where of the many rehab services offered through Morris Hospitals and its healthcare centers. Tell us about physical therapy.
Okay, well, I know that we've talked a lot in the past about all of the therapy services at Morris Hospital, but thanks for asking me back again to talk about our therapy services today. We have physical therapy. As you know, they really focus on reducing physical limitations caused by many medical problems with a focus of returning to work, activities, hobbies. Our physical therapists very much work on improving your mobility, strength, balance, decreasing pain, and hopefully helping to reduce fall risk. We have several specialized services with physical therapy: lymphedema, concussion, orthopedic injury and surgery, functional capacity evaluations, work conditioning, dizziness and balance, torticollis, and of course Parkinson's disease, and the list goes on.
Torticollis, can you explain what that is?
Yes, that's when young children, infants, have a shortening of the neck muscles and the head is pulled to one side. It's just one of the specialty areas that we help our local community with. It's uncommon, but we do see it and are able to help parents combat that problem.
Yeah, that's outstanding.
Yeah.
Tell us about your specialty, the occupational therapy side of rehab services.
Well, yes, I am an occupational therapist by trade for several years here, more than I care to tell you, actually. But anyway, our occupational therapists are really focused on the safety and the independence with everyday living activities. And things like that include bathing and dressing, toileting. We also look at pain management, looking at exercise to regain strength and movement. We also look at splinting, positioning devices to help a person recover, and again, with the main goal of returning to their everyday activities as independently as they can. Some of the specialized services we look at our hand therapy, orthopedic injuries, people who've had strokes, Parkinson's disease, all of those things, looking at the basic skills, something as simple as cooking or bathing, using a keyboard, opening jars. That's some of the areas that your occupational therapist is going to be helping you to resolve if you're not as independent in those areas.
Sure, and just the maybe daily task kind of things that some of us could take for granted, right?
Absolutely, and when you're no longer able to do them, then definitely your occupational therapist is going to be able to help you problem solve so that you can figure out a way of regaining that independence, working around it, or regaining the skills to be able to do that.
All right. Well, I guess next we'll jump to, and I understand that this is only available in Morris, but the speech therapy aspect of rehab services.
Absolutely. And the speech-language pathologist provides evaluation and treatments in three main areas: the ability to swallow, cognitive disorders, or another way of saying that is the thinking skills, and then, of course, the area that most of our community would know a speech-language pathologist for, and that's voice problems and speaking and language. And those problems can result from head injuries, from strokes, respiratory issues, and many other medical conditions. So they look at helping a person regain a vocal loudness or sound quality, speaking and understanding speech, memory, difficulty with swallowing, difficulty with chewing, all of those things. And one of the symptoms there is coughing and choking with eating and drinking. That usually leads us to believe that there might be an issue. So the speech-language pathologist works in all of those areas. And yes, as you say, our program is here in the Morris at our Gore Road building.
Okay. All right. Very good. Anything else before we conclude?
I just wanted to remind people why they would choose Morris Hospital. That's always a question people ask me, because people have a lot of choice, of where to go for their services. And as many people know who live in our area, our mission is to improve the health of area residents, and all of our departments in our organization really hold true to that belief. And one of the other reasons why I choose Morris Rehab particularly is we have a lot of therapists educated to a very high standard with certifications. Hand therapists, lymphedema therapists, vestibular therapists, which is dizziness and balance. And our team has made a commitment to become as well educated as we can so we can bring the latest and greatest to our community. And then the last thing I want to say, it's a little bit cheesy, but it's true. We're pretty nice people. We live and work in the community. Our friends and family are here, and we like to take care of everybody as if they were a member of our friends or family. And, I know a lot of therapy places say that, but we truly mean it at Morris Hospital. So they'd be the reasons I would choose Morris Hospital for sure.
Absolutely. Sarah Wrightson, occupational therapist and manager of rehabilitation services for Morris Hospital and Healthcare Centers. Individuals experiencing physical effects of an injury or medical condition may benefit from physical, occupational, or speech therapy services, or a combination of all three. Morris Hospital can help you return to maximum independence and the activities you love. Morris Hospital even offers free transportation to and from therapy appointments. Rehabilitation services are available at locations in Morris, Channahon, Diamond, Coal City, Joliet, Ottawa, and Yorkville. To learn more about Morris Hospital's rehabilitation services, for physician referral assistance, or to schedule an appointment, call 815-705-7828. You can also visit morrishospital.org and click on Services.